Hello everyone. Today we are going to discuss about snake bites and their venom along with its best prevention practices and of course its cure. Friends, snakes do not attack people. They are often startled or put in a situation where they feel the need to defend themselves and hence bite. Snake venom is a white or yellow colored liquid which is produced in glands located in upper jaw of snake behind its eyes. When a venomous snake bites down on something or someone, its venom is pumped down through a duct known as venom canal to the fangs. The fangs acts like a hypodermic needle, injecting the venom quickly and efficiently into the unsuspecting victim. The fang's length can be very small to very large depending on snake species. To identify a snake bite, consider the following symptoms: 2 puncture wounds, swelling and redness around the wounds, pain at the bite site, difficulty in breathing, vomiting and nausea, blurred vision, sweating and salivating, numbness in the face and limbs. Guys, there are two main types of snake venoms. One is hemotoxic while the other is neurotoxic. The hemotoxic venom attacks bloodstream, triggering lot of tiny blood clots, putting a lot of pressure on human heart and punching holes in the blood vessels, hence leading the person to bleed to death. The neurotoxic venom attacks the nervous system and stops nerve signals from getting through to muscles. This can lead to full body paralysis that ends up making the person unable to breathe. Don't worry, let's talk about cure of their venom. Guys, there is a way to treat snake venom by using antivenoms. Antivenom is traditionally made by collecting venom from various venomous snakes and then injecting small amount of it into a domestic animals like horses and sheep. The antibodies that form in that domestic animal are then collected from that animal blood, and after purification, these antibodies, which are also called plasma, are then used on infected person either by an injection or through an IV, and the patient recovers very quickly after receiving the antibodies. But there is a problem. Antivenoms are very expensive and only produced in limited quantities. The average price for Crofab antivenom is around $3,000 per vial, and only few people can afford them. Though the exact number of snake bites is unknown, but according to WHO, an estimated 5.4 million people are bitten each year, with up to 2.7 million are bitten by venomous snakes. Around 81,000 to 138,000 people die each year because of snake bites, and around 450,000 amputations and other permanent disabilities are caused by snake bites annually. Agricultural workers and children are mostly affected. Children often suffer more severe effects than adults due to their smaller body mass. So what to do if someone is bitten by a snake? After a bite, victim should not move the affected limb unless they have to. Keep their heart rate as low as possible until they reach hospital and receive appropriate anti-venom treatment. Also, be sure to take following steps immediately. Number 1. Remove any jewelry or watches, as these could cut into the skin if swelling occurs. Number 2. Keep the area of bite below the heart in order to slow the spread of venom through the bloodstream. Number 3. Remain still and calm if you can. Roll over to your side and rest in recovery position. Moving a lot will cause the venom to spread faster through the body. Number 4. Cover the bite with clean and dry bandage. try to use a pressure immobilization bandage if you can. This type of bandage should be tightly wrapped around the bite and then wrapped another bandage around the entire limb so that it's immobilized. While these are useful precautionary measures, the ultimate treatment for a snake bite is anti-venom. Try to get the victim to hospital as quickly as possible. And lastly, knowing the size, color and shape of snake can help your doctor determine which anti-venom is best for that particular situation. But how can you prevent a snake bite from happening? Depending on where you live or go for a vacation, you may or may not have a hard time avoiding snakes. But if you are going in a snake's territory, there are some useful tips to avoid getting bitten. Number 1. Always be careful where you put your hands and feet. Do not reach into unknown spaces and holes or underneath objects without first being sure that a snake is not hiding underneath it. Number 2. Do not lie down or sit down in areas where there might be snakes. Number 3. Wear high-top leather boots when walking through or working in areas with dense vegetations. Number 4. Do not attempt to capture, handle or keep venomous snakes. Number 5. If you are going camping, take extra care around swamps and other places where snakes typically live. Number 6. If you come across a snake, slowly back away from it and avoid touching it. Guys, if you want to know more about snakes and other reptiles, then check out our next video. If you have not subscribed our channel, then do subscribe it now to never miss out our upcoming video series. And lastly, share your thoughts in the comment section below. Thank you.